Hi, everyone. Really excited for this week's guest. We have in studio Nancy Smith with Personify Health. Hi, Nancy. How are you?
Hi, Shannon. I'm great.
So good to see you. I know we usually run into one another on the conference circuit, so it's great to get to chat with you and learn a little bit more about what you're doing with Personify. And I know you've been in the industry for a really long time, and so would love to hear just your thoughts of how things are going, what you're seeing going on out there in the industry, what you're doing now over at Personify. What are you up to and what's going on over at Personify these days?
It's been a great time at Personify as we were Virgin Pulse and we merged with Health Comp, which was the largest TPA in the country. And it was time to take a look at what we do over here. And Personify Health is a health and well-being company. And we support the full health journey. And that means everything from benefits and care navigation and advocacy and prevention and communications. And so it's all wrapped into one package. And so we rebranded as Personify Health, and it's been great. I think what we offer is a very holistic view. And one of the things I just really love about what Personify does is the data that we have. And I know there's a ton of companies out there that say, oh, we've got data and we identify your members and things like that. But the fun part of data is really drilling down into your members. So, just for example, if I gave you a clue of an elderly gentleman in Europe, British, very wealthy, very famous, lives in a castle, who would you think of?
Michael Caine. That's Sir Michael Caine or Ben Kingfold.
I
Right?
was thinking about Osborne.
True?
Warren.
Oh, okay. There you go. I forgot. He was never.
So,
All right.
the demographics, they've got the same demographics, but what do you know about these people? And it kind of ties into the fact that I was talking with someone at a conference just recently, and we were talking about the boomer generation. There's an 18-year span across the boomer generation.
What?
So you are not going to market at the very young end of a boomer and the very top end of the boomer the same way. So really drilling down into these characteristics is so important.
And this image of Ozzy biting heads off of bats.
Fragrance. For work, I'm is he vegetarian now? I don't know. For- I don't know. But
No, but I think
to
that's
find out.
I think that's a really good point is that you know someone, don't know someone until you know someone. And in just thinking, I just shared with you the story that I grew up with as a young kid. And I remember Blizzard of Oz and listening to that music when I was younger and stories about. And then I know, and I never watched the reality series, but I understand that it presented a very different view of him as a person, maybe too, because of age. But I think that's a great example because, again, we think we know things about people. We have bits of data. We make a lot of assumptions, but really there's much
Mhm.
more, right? There's much more complexity to people. And so I think that was a fabulous example. I know in preparing for our interview today, we talked a lot about data. And I know you mentioned it's difficult out there because there's a lot of people that talk about the data that they have and what they're able to do with it. And I thought it was interesting, some of the stories that you shared with me about Personify and some of the cases and things like that that you were able to build. Do you mind sharing some of those with us? I thought those stories were great, and I know that our audience would be real interested in them as well.
Sure, because I think really looking at your databases and people are more than their claims. They are more than their pharmacy refills. And so taking into consideration everything that we package in to data in this day and age, you really need to look at it. I think one example that I always go back to was a story of there was a lady that went into the ER and She uh, she went into the ER, she was getting better, they sent her home with her medication. The medication bottle says take once daily. In Spanish, that's once, that's 11 times.
Oh my
He
gosh.
kept going back to the ER because they didn't realize that Spanish was her first language and she barely knew any English. So, really, truly knowing things can save people's lives. You knowing that information about your member can save a life. I think in that case as well, trying to market to certain cultures and certain elements of SDOH, you really need to truly know your members. If you're putting a young American male on the phone trying to talk to an older Hispanic female about going in for a mammogram, that message gets lost. There's a lot of cultural differences in working with a Hispanic female versus a maybe 20-something-year-old trying to get her to go in and get her mammogram. So knowing to put Spanish-speaking female and possibly Hispanic on the phone with that person can drive that action better. And it's knowing that data behind it to be able to coordinate with your member.
I think that's so important. And that story, I didn't even think about that. You've heard of stories like that in the past about what was it, the Nova? It means no go, or that was,
Yes.
yeah, that was
I
advertised.
didn't know.
And I had never heard that about once and once, and that just seems, it seems so simple that one wouldn't miss that. But I can totally see that. It didn't even come to recognition. I think one of the things that I found interesting when we were talking about some of the data stories that you were sharing was just the different data sets that you guys are able to bring together and how you're able to tell stories. Can you talk a little bit more about that and what really differentiates you from maybe other offers of data out there, if you will?
Yeah, and I'm really glad you asked that question because really knowing the categories and the data sets that you have is crucial to being able to coordinate a good digital strategy. A lot of people say, yes, we've got all of this information, but are you really stratifying your members? Are you pulling out the ones that have risk of stroke? Are you pulling out ones with ER usage, behavioral health models? We have about 250 models over at Personify Health. And just for example, over 20 of those relate to medication adherence alone. And so are you taking that data and stratifying groups accordingly to your solution? And is your data strategy, is it deliberate? Or are you just checking a box? I really look at a lot of these strategies and these coordination of these models to make sure that you're not just checking a box going, okay, we need to get this many mammograms closed this year. We need to get this many A1Cs. We need to get this many diabetic retinal eye exams. Are you improving it year over year, or are you just meeting the minimum number that's required? Are you communicating in a way that means something to that member? And in doing so, you look back on the old adage of marketing. Oh, it takes 7 touches before someone follows through with your ad or takes an action. Is there a way to utilize this data so that you're not touching them 7 times, but maybe you're touching them 3? I know that Mary Jones is going to get an email and then respond to a text message after she gets that email. Boom. You've saved time, you've saved money, you've eliminated some of the outreach to this woman because how many touches do we do with as a health plan to your members? It turns into a lot of touches. You've got claims, EOBs, reminders, refills, community events, test results, HRAs, welcome packets, opt ins. You've got all this communication, but are you using your data to really stratify the communications that are important to that member and to make sure that you're avoiding that member abrasion, but you're accomplishing your goals?
I think you bring up a really good point. There really needs to be, and I was talking about this with someone else the other day too, this paradigm shift. in healthcare if we really want to be successful. If you look at all the changes that have come down the pipe, and also too, just the way our world has changed, people expect to have that personal, authentic touch, if you will. Netflix makes recommendations to us as far as what movies to watch. Amazon will make recommendations to us as well. We expect to get our things within 2 days. We have this expectation around personalized service. And I find it interesting that in a world where, such as healthcare, where things should be personal, it seems like we're still resisting that. And you bring up a really good point in that we just send all these different pieces and we feel like if we just touch people more, we don't really think about how we're touching. We just touch them more. And that's the answer to scalability is to increase the volume. And the emphasis is on quantity. But I think you bring up a really good point about quality. It's really the quality of that interaction that's going to, and I know being a leader for quality, I've managed both quality and risk. Medication adherence was particularly difficult, or even like the instance that you brought up about mammogram. You really have to know, what the barriers are for that patient, and there's so much more than even just ethnicity or gender or age or what have you. I would love to hear. I thought the examples that you used were great. Let's do an interesting one. What's been the most challenging or interesting case that you guys have maybe worked on or a population that you stratified for a client?
So years ago, one of the challenges was getting women to get in for a osteoporosis screening. And that's generally done after a fall. Has to be done 180 days after the fall. Health plans will try to reach out to that member and get her in. And I say her because generally it's more women than men with osteoporosis. The funniest part about it was in the 90210 zip code, Beverly Hills. And uh, at the time, the company I was working for did in home osteo testing. These women did not want people coming to their homes. The plan used something very creative, which I loved. They used gift cards to a med spa, and they would go in and get a pedicure, or they would go in and get a facial, or they would do whatever and use that gift card and get their osteo screening done right there at the med spa. They set up a HIPAA compliant room and got these women in and got the screenings done. The fun thing is they also took their friends in, and the med spa was thrilled because they're getting more business and the osteo gaps were getting closed. But knowing how much that one measure meant to that health plan to be able to do something like that and go after these women and say, look, it is important to us to get this closed for your health or reimbursements and get this gap closed and make sure that everybody's satisfied. It was a really creative and fun way to get women in to get their gap closed. Not everybody can do that. Not everybody has the budget to do that. But when you look at the reimbursements and what you could lose in your rating versus what the plan needs to do to get that gap closed, it made sense on an ROI basis, just on a one-off case. But it was pretty fun.
I think that's a great example. Yeah. And I know you talk about budget and that's important, but if you're not sending a million things that aren't working and you're able to focus and really target a particular population, and maybe it's not covering the whole service, maybe it's a portion of the service, or maybe it's organizing an event. I love thinking creatively like that. And I think that's a great example of showing how one can really think about how you can engage members authentically and get results. And to your point too, it's not just about closing that gap. They brought friends that could potentially then become members in the future. You have patient engagement because you did something for them, right? They're more likely then to engage in other things that you might need. There might be opportunities to close other gaps while they're there. I think that's a brilliant idea, and I would go. I think that's great.
All right. Yeah.
I would love that.
Yeah. And I think of So many of the plans that I have spoken with, especially in the last couple years, because you mentioned budgets, and we talk about so much involvement in a digital transformation. And you break that down and can literally, I had to write it down because the components of a digital transformation includes things like legal, compliance, engagement, integration, scalability, connectivity, HIPAA, member touches, member services, innovation, analytics, dashboards, reporting. There is so much involved in a digital transformation. And so you really need to look at, again, like I talked about with your deliberate strategy. Are you just checking a box or are you looking to improve? One of the things I really love about Personify is when I sat down and looked at coming over here, because I've been here not even quite a year, is the fact that the solution that we have is used across the organization. So it can be used in member services, it can be used in Star and HEDIS, and the data can be used underlying all of that, and also in risk and identification of areas of improvement in population health. And with all of the models that we have, it's such a great way to really take one solution and apply it across the organization because you don't want to be that health plan that has one vendor over here, one vendor over here, one vendor over here. Nobody's talking. You want that dashboard, you want those analytics, and you want that data to be the most powerful tool in your organization.
I think that's so important too, because I think that you do run the risk. While you need to make sure that tools that you're employing do the things that you need them to do, you do run, right? There is that risk of having things that might not be complementary or work well together. I would love to hear about one of your clients that you're working with today. You don't have to mention them by name, but maybe take us through the front door of the member signs up or even maybe before the different areas, if you could go into a little more detail of what it would look like in member services using the data that you guys have available, what it would look like for some of the other departments, and how folks might be able to use the data that you have available on the different models that you have.
Sure. So I think the important part is when we work with one of our plans, specifically and on a very specific campaign on ROI on medication adherence. You start at the implementation and you really want to know how well that health plan knows their member journey along this campaign. And so we're going to be working with them on what factors are important in knowing that member, the methods of communication, the demographics, what SDOH information we have on this member, because it's going to affect how this campaign is run. And we have had successes in reaching members and getting an 89% success rate in getting them to refill their medications. Over 65% improvement in some of the areas of medication adherence and taking their medication because we're educating them on the importance of that medication. But you also need to look at the health plan and make sure that they are taking information that they're getting back in. If a member is not taking their medication, why? Is it making them feel bad? Is it too expensive? So it has to be a bidirectional pull of data so that the data that we're providing also gets added to by what the plan is finding out about why that member is not taking the medication. So when we look at a health plan, it has to be a coordinated effort with that member. It can't be, let's just give you the data. Let's just get this communication out the door and get this campaign fired out and you're done. It really has to be a learning process on both ends. And we will take campaigns like a medication adherence one and find out if we're not communicating and getting success rates, we are nimble enough to turn those efforts. If phone calls are more important or snail mail is more important, we can turn those efforts quickly to still in the middle of that campaign, drive those numbers to a more improved rate.
I think
Make sense?
it does, and I think that's so important, and it resonates with my experience too. I know that a lot of folks, I think, thought that or one of the criticisms is that campaigns are expensive and that to be able to do all those different channels or how many people do you have to tell? And in my experience, I found that when you're running a campaign, it isn't enough to say, tell the doctors, tell the customer service agents at your health plan, make sure that in any way in which that patient might be touched, maybe it's your care managers, that they know what's going on and that everybody's aware because you never know who they might reach out to. And to your point about mail and phone, I think we need to think about, like you were saying, our population, especially the older population, they might be less apt to pick up the phone. However, if
Mhm.
you send a mail piece ahead of time, letting them know that they're going to get a call, and there's something about the credibility, right, of having something that you can actually hold in your hands and read. And then we used to do follow on calls. So we would mail cards or letters first, and then we would follow up with phone calls. And we found that we got much better traction. And in my mind, it's a worthwhile expense to be able to use those different methods. And to your point, to pivot as necessary. You might need to send another postcard or what have you, or text message or some other medium that's appropriate for the audience. And again, I think it's thinking about it's not quantity. And even in that case, it's not quantity, it's about quality of the outreach and really being able to apply the strategies that would be appropriate for the membership that you're working with. I think that's fantastic. We're talking about data and how important data is and using it to inform member outreach. But I think that there's another side to that that we need to be thoughtful about, especially with a lot of the recent challenges around data breaches. Can you talk to us a little bit about data integrity and what data integrity looks like at Personify? Maybe some of the steps that you guys are taking to what you're doing to protect that data and use that data in a way that safeguards our members' history as well.
That's a great question. Personify uses over 40 sources to aggregate their data. And the models, I love the models because some of them are crazy. Some of them are, if you drive a domestic sedan, you have a higher chance of this disease. And it gets very pinpointed with anywhere from a 97% accuracy on up. And these models are like you'd think that they were out there, but they're not. They are trends and things that we see about the members. People ask a lot about it being very big brotherish. We don't want to know that Nancy Smith orders this kind of a pizza on a Friday night. And I don't want somebody to pinpoint everything that I have. So we do a thing called data twinning. And what it is categorizing and developing these models around a certain group so that I know that if Nancy Smith has these diseases, that she is more likely to be taking these kind of medications, to be doing these kind of activities and needing to push these kind of engagements and what kind of actions we need to get Nancy to do. And that way, we're not telling the health plan on their data that Nancy Smith has this, but we're saying people like her need this kind of communication. People like her will answer to a text message. And I think that's really important because we keep all of our data siloed from each customer to each customer. None of that data gets aggregated together. Also, we're high trust. We're SOC 2. We've got all of the HIPAA compliance that's out there in the industry that is important for security and compliance to make sure that our clients are kept safe from possible data breaches and things like that. There seems to be a data breach every week, and the recent ones of Change Healthcare, they're massive data breaches. And it used to be we'd see these data breaches and go, oh my gosh, oh my gosh. Now it's, oh, who's having one this week? We work every day to make sure that our data is kept separate, it is compliant, it is secure. We have all of the top certifications in the industry that you can possibly get over at Personify.
You talk about these data models, and I think it's fascinating. And I know you mentioned some of the traits that might be included. Tell me a little bit more about some of them that you have. And I know you're pulling in other data because I know you said that people are more than their claims. And we know that, right? Because claims is not even complete. But what other types of pieces of data are you pulling in? What are some of the models that you have? I would love to hear how you've crafted and composed some of those.
Yeah. So I mentioned over 40 sources, and those sources they encompass things like consumer buying habits, voting registration, social determinants of health, the nutrition, the financial, the housing, the transportation information that is so critically important to know about the members. Of course, it's the standard things that everybody adds in, the ethnicity, the gender, the age groups, the income, things like that. But when you pull in those things with our 40 sources, and some of these sources are not available to other people, and we keep it very clean. We are constantly doing data hygiene on our data sources and what we're creating. And I talk about these models, and I can't really say what the models specifically are, but again, if you take all the consumer buying habits, the SDOH and things like that, and create these models, other companies are going to say, we've got models too. But so often are they developing these models according to trends and things that they're seeing? Are they taking these models out? Because again, if you're using a model for a baby boomer that is 18 years older than than the late stage baby boomers, your model could be completely inaccurate. So we're constantly turning these models and taking a look at, are they accurate? Are they following the trends in the industry? And are they accurate to what you need to drive as your action?
You've introduced so many new concepts to me. I think 20 was the I first heard from you. So thank you for that. And then you just mentioned data hygiene, and I know we had talked about that before too. Can you talk a little bit more about what data hygiene is, what that means to you, and why it's important?
Sure. And you've got to keep your data accurate. In a day and age with opt in and opt out, we work with plans on their compliance. And of course, that changes from plan to plan and state to state on what the compliance is on opt ins and opt outs. So you want to keep that clean because I, as a consumer, I get upset with retailers that constantly text me or email me when I have unsubscribed to their list at least 10 times. It's frustrating. Plans suffer that too. Our data hygiene and our information is constantly refreshed so that we aren't doing that and we're avoiding that with health plans members. It is important. You've got to have the right phone number. You've got to have the right address. And in a day and age when a lot of the Medicaid population is a little bit more transient, and having that information, because one lady could be living with her family members for a while until she gets an apartment of her own. It's important to have information that is kept up to date because you're going to be sending a communication out to the abyss and it's not going to drive an action like it should.
No, I think that's great. So I've heard not only is there data sets out there that you're able to pull in, the health plans have data that you're able to merge with. You're able to be responsive and use different communication vehicles for how you interact with patients and can put that data to use across the organization and various departments. And I loved hearing about the various use cases that you guys have too. So that's great. All right, Nancy, I know we've been seeing each other for a long time around the industry, and I always love seeing you out at the various conferences that we attend. Would love to hear. I'm going to ask some fun questions here. What's your favorite thing about conferences? And if you would have any recommendations for others in the health industry for how they might make the most of their conference experience?
That's a great question too. You've always got great questions. That's why they call you doctor. I don't know about that, but thank you. I have a love-hate relationship with conferences. I think we all do.
Yes.
You're getting on that plane and you're like, "Oh, another conference.
Yes.
Please don't send me to another conference." And I walk out of the conferences with such a high. I take crazy notes, not only listening to the health plans, but the vendors out there, because so many vendors are having these conversations and talking with these plans and health systems and other organizations that are health related. And it's so wonderful to see the collaboration. And I adore when I have a plan that gets up on stage and they talk about something that didn't work.
Yeah.
They're honest because not everybody has a success story from the get go. They talk about their learnings. And anytime I can bring a learning back to myself and the day to day job that I have or my organization is fantastic. And I also learned that no one is the same out there. While plans are all very similar foundationally, they all face different challenges with their members, their budgets, their internal structure. They're all unique in a certain way. And so I love trying to craft something that works around solving their needs. And so being able to listen to vendors and plans at the conferences always lets me walk out with a learning. But some of the conferences are better than others, but I've really enjoyed you and I am enjoyed the RISE conferences really well. The SSN ones are terrific too. And then you've got the giant ones. You've got HLTH, the health one, HIMSS, AHIP. There's some terrific conferences out there to really learn about the trends that are coming down the road. And I think that's really important too.
I agree. I think it's important to stay abreast of new developments and things that folks are experiencing. I know I had spoken with someone the other day, and the tenor of the message was just that they had the answers. And I would agree with you. I think that there's more to be learned in mistakes and of course getting up after any failing, but we should always be in a state of learning, right? Things are always changing, the industry is always changing. We need to stay on top of those changes, and then to the extent that we can collaborate and learn with one another and from one another is so important. The industry has gone through a lot of changes, and I know you have a lot of experience as well. Would love to hear your thoughts on what you either have the most concern for coming up or that you're hearing even from clients. And then also to anything that you think is a bonus, something that is going to be a positive development for us that you see on the horizon that folks should be aware of.
So, one of the trends that I see, and I've really looked at a lot of different angles of healthcare. And I was lucky enough to be invited to an AMA roundtable
Nice.
at the AHIP, and it was great. Some of the most brilliant minds were sitting at that table. And we were all talking about the fact that 5 years ago, heart disease was the number one killer. And all of the people were talking about the trends that they're seeing, AI and technology and all of the things that are coming down the road and medical devices and all of this. But we're sitting there 5 years later and heart disease is still the number one killer. And so one of the things that with all of the fantastic technology, all of the communication efforts, to me, the biggest part of healthcare that we really need to look at is keeping it simple.
Yeah.
You want your member to have resources. You want your member to be able to get in with a provider. I think you told me how hard it is to get in for a colonoscopy in California.
Never
You
call it
never, you are works. That
Let me see.
stunning to me. They advertise it in Nebraska. I don't know, it must be like a fun event to do or something, but giving that physician the resources to treat that patient and the health plan to be able to communicate with the member. To me, I think we need to take all of these fantastic opportunities in technology and turn it back to us and say, but are we keeping it simple? In the end, we want healthy members. We want to meet our budget and we want to make some money too. Not everybody's a nonprofit. So, where can we take these trends and take this data and turn it to keeping the industry simple and making the connection with the people who are disconnected and keeping the people in the health industry all connected at once so we all have the same goals in mind? I think we all need to be on the same page.
I love that. I think that needs to be put on a t-shirt, making the goal to keep people from being disconnected. So that's great. I would also like to ask you, there's been a lot of talk on my on podcast about leadership, people getting into the healthcare space, the future of the industry, and specifically around careers. Any recommendations that you would have for maybe newer comers to healthcare, maybe those that are in, say, years 1 through 5 or even 1 through 8? Recommendations that you might have for them?
Oh, yeah. So my start in healthcare was maybe 13 years ago or so. I can remember my first job. I was on the airplane Googling the difference between Medicare and Medicaid down to my interview. And I was like, no wonder my parents always look at me with kind of deer in headlights when I would ask them about their Medicaid. They were like, they were on Medicare. I had no idea the difference. And since then, I've just found a passion and a love for healthcare. I think the change in it is constant. It doesn't matter. You're going to have one administration or another administration. You're going to have changes,
Yeah,
whether those are good, bad, or indifferent. I think you're going to always have challenges in getting people to get interested in keeping themselves healthy. I think we need to look at the trends of and looking at opportunities that you can help in the healthcare industry in proactive health, keeping people off the GLP-1s. What can you do ahead of time to keep them off of that? I think those are areas that people starting out in the healthcare industry should really look at the trends of how we can keep people from going into bad health when we can. And I think those are the opportunities that people should take a look at. I think getting out there and networking, getting in front of people with those conferences, the trade shows, the online webinars is so important to really keep a hold on the industry and know what you're doing and how it makes a difference in the healthcare industry.
I love that. I think it's so important to think about the end game, right? What's the end goal, the end state? And what you said about don't necessarily focus on the results, but focus on the cause. And so if we can make a difference there, and that should be the driving passion or the larger message as to why we get involved, and love that you recommended that the collaboration and staying educated. I definitely think it's an industry for those that if you want things to be changing, you don't want to wake up and do the same thing every day because it's definitely always changing and we're always having to put on our roller skates and figure which way to go and how fast and so on and so forth. Anything else that you want to share with us today before we stop our interview or end our interview?
And then what I just really loved the opportunity to do this.
Me too. I love your stories. I'm glad we got to talk about the AMA too. Nancy, really appreciate your time today and really enjoyed talking and look forward to hearing more from you and Personify Health in the near future. So thank you so much.
Thank you. Appreciate it.